Welcome to the Smiling Dentist program today. We will have him himself, the Smiling Dentist, facing 12 difficult and extreme questions given by young children over the world. Today I have a few questions for you from my friends at school and their brothers and sisters.
Oh, great.
So, would you like to start?
Let's start. Let's do it.
Most children are actually scared of dentists, but for me it's actually a bit easier, you know, because it's my dad and I trust him a lot and I love him so much. And now this question is from Fatima, which is 6 years old, and that is Alicia's younger sister. What is the best toothpaste for 6+?
Oh, that's a very pertinent question for a 6-year-old. Very good question as well. The honest truth is, toothpastes are much of a muchness. As long as they have fluoride in it, and again we touched on fluoride earlier, but fluoride is a really important ingredient that helps to protect our teeth. What it does actually is those minerals I was talking about, it helps to bind them in tighter to the tooth, so it's harder for the acid to remove it and start that decay process. But we also know that fluoride in very high concentrations when we're young can affect the adult teeth that are forming. Okay, and it makes them brown or stained. The term is mottled, okay, and the technical term is fluorosis. It's for that reason that when we're of a certain age, below 6, or in fact below 12, we use toothpaste with less fluoride in it, because it still helps to protect the teeth, but you can't get to the point where you have enough fluoride to damage the adult teeth that are coming through. So definitely, if you're 6, have the right toothpaste that's age appropriate, but whether you like Colgate or whether you like Aquafresh and you like the taste of those ones, it's absolutely fine because they'll do the job of cleaning your teeth well.
Next question. Now this question is from Alicia, which is 9 years old. She says, how do bugs create cavities?
Ah, very good. So I know it's similar to a question that we had earlier about cavities, but what we'll talk about this time is exactly what happens with these bugs, these bacteria that are in the mouth. So we have these bacteria that they really like sugar. And what they do to sugar is they convert it into acid. And it's the acid or the acidic environment that allows these minerals to be pulled out of the tooth. And it's when the minerals come out, that's when these cavities weaken and form. So it's really, some people unfortunately have more of these bacteria than others. And so some people will have, the word we use is a predisposition, or are more likely to get decay in their teeth than others. So it's not really fair. Some people will get more decay than other people will.
But then why do they get more decay than other people do?
Well, it's a really good question, but it's like asking why are some people tall and some people short? So it is just how it is. Genetics plays a massive part in it. So generally, if your parents are tall, you'll be tall. If your parents have bad teeth, then it might also go that you will have bad teeth as well. Now, that's not to say that you shouldn't look after your teeth as best you can. But sometimes when you see the dentist, they'll say to you, look, I think that you are more likely to get decay than the next person. So it's really important to take their advice on board, and if you need to brush better, if you need to eat fewer sweets, then you've got to do that, because otherwise you will you'll get more problems.
This is from Zoya, which is also 9 years old. Why is flossing so important?
Our mouths are full of bacteria, okay? And actually we used to think that the bacteria were all bad and we have to clean them all away. But that's not the truth. We live with the bacteria all the time, in our mouths and in the whole of our body. What's important is keeping an understanding that there are some good bacteria and some bad bacteria. And what we don't want is to allow an environment where there's too many bad bacteria. Okay. Why do bacteria become bad?
Yes.
Because in the mouth, the bacteria organize themselves into what's called plaque. And the plaque is that soft white stuff that you can scrape from your teeth.
Stuff.
Exactly. So if the bacteria become very organized, every day they can lay down some bricks and they can create a wall. Now, the bacteria at the bottom of that wall, they can become quite toxic. They are the kind of bacteria that will cause us problems, gum problems, and also decay in our teeth. So it's really important that when we brush our teeth, we disrupt that so the organization is removed and it goes back to being the friendly bacteria again. So brushing is brilliant because we can clean and disrupt the plaque on the front and on the inside surfaces of our teeth. But what the brushing doesn't do very well is clean in between the teeth. And that's where the flossing allows us to get in to disrupt the plaque in between the teeth.
So our next question is from Lakshmi, which is 9 years old. And she says, what is it like to train to be a dentist? And are there different types of dentists?
Ah, yes. So it's really fun actually training to be a dentist. It's hard though, it's really hard work. Lots and lots and lots of people want to be dentists, which is great. And because everybody wants to be a dentist, then the people who pick who gets to start to train, they can choose anybody. So they generally ask that you will have A levels and you need to have special ones. Biology, chemistry is a must, and maths is also a good one. And you need to get good grades. You have to have A's in all of them minimum. And once you've done like good academic stuff, so good studies, it also helps if you were doing other bits at school, maybe playing sport and I don't know, maybe a prefect, head boy, head girl, those kind of things as well. It means that when you go for interview, then they will accept you. I was lucky enough to get into dental school, and it's a 5-year course, so it's quite a long degree, and in it you do lots of learning in the first couple of years, but then after that you start doing a lot of practical stuff, so you actually treat patients, even though you're still learning, but you're learning on the patients under supervision. And then you qualify and you become a dentist, and you might think 5 years is enough to learn everything, but it's not really. It's enough to make you safe, but you learn lots and lots and lots, much more advanced things as a dentist. So I've been a dentist for about 16 years now.
Wow.
I'm still learning now because there's always new things that are coming out. There's more advanced techniques for doing amazing things to help our patients. And it's what drives me, and I really enjoy being a dentist. I'm a general dentist, which means that I will see patients, any patients, and then they'll come into me and I'll help as many as I can. But if they've got a really difficult problem, let's say for example they've got a really weird problem with their gums, then I can send them to a specialist who looks after gums only. That's called a periodontist. If their teeth are wonky, then I can send them to a specialist dentist who just straightens teeth. He's called an orthodontist. So there are all these also different specialities: endodontist, prosthodontist, oral surgeon. So as a dentist, you can train to become a specialist as well. So it's a really varied career, and one that I love. By the way, you have a lot of friends that are 9 years old. Are you by any chance 9 yourself?
Yes, I am actually.
What a coincidence.
And now our question, last but not least, is Esha, which is 9 years old. Can you get pictures on your braces? If so, can you get animal ones? Great
question. You can get braces that have animal prints on it, animal stickers.
Oh, wow.
There is a brace, it's a clear brace called Invisalign. And the idea is that we can move teeth around without anyone knowing that you've got braces on. But if you want to show off and you're actually quite proud of the fact that you have braces, then you can put little pictures on, and animals are one of the pictures, like one of the group of pictures that you can put on these little stickers.
That's amazing.
Another way of moving teeth is with, like, you know, the metal braces, they're sometimes called the train tracks.
Yes.
And if you have those ones, then you can't get animals put onto those ones, but you can have bands which are different colours. And you can change those every time you go, like every 2 weeks. So if you've got a favourite football team, for example, then you can put the colours of the favourite football team on it as well.
So this question is from Anna, which is 10 years old. And she says, I'm very scared of the dentist. I'm scared that there'll be pain when I go to see him. So what should I do?
Yes, that's a really, really good question. All I can say is be brave. Be brave and go. Because normally when children come to the dentist, there's nothing wrong. Or there might be something that's going to be wrong but doesn't need treatment at that stage. So if we can give advice on how to keep everything healthy, if we're given the opportunity to do that because the kid comes, then that's the best thing we can do, because we can keep things healthy. Now, if, however, there is a little hole and some treatment is needed, very often we can do that treatment without having to do anything bad at all. Like, we can get the decay and just take it out with a little spoon and put some filling in and seal things. So that's also really nice. But we can do that when there's no pain and when the holes are quite small. Now, if we keep avoiding and then we do end up going to the dentist, then it's more likely that we might need more treatment. But I have to say that we can be really careful with the way we do things. We can give special gel, we call topical anesthetic, that we put onto the gum first, and then the gum goes to sleep. And that means that if we do need to use the needle to inject, then you don't feel it because the gum is already numb. So it might feel a bit weird, it might feel odd to be numbed, but there won't be any pain. So I want to reassure you that coming to the dentist is a safe place to come, and it's a place that will help you to keep healthy, because that's what we want to do. So don't be scared of coming, feel confident.
And I just want to add something else onto that as well, because in storybooks and things like that, I'd say if you've read David Walliams' Demon Dentist, this boy is very scared of the demon dentist. But there's nothing to be scared of a dentist. I know that that might sound crazy, and I maybe just be saying that because my dentist is my dad, but there's really nothing, because they numb you, you don't feel anything at all. It's just like a really nice man that you would see on the street, and just imagine, like, he's not going to do anything to you, nothing can go wrong. So I just wanted to add that.
That's really lovely. And then there's one last bit of advice I would give, that courage is a really amazing thing, okay? But remember that courage is not being scared. Courage is being scared but doing it anyway. Now that's an amazing thing, not just for going to the dentist, but for anything in life as well. So I'd really like you to be courageous, be brave, and do what you know in your heart is the right thing.
Thank you, the Smiling Dentist, for joining us today. And I just wanted to add on that if you have any questions about the dentist yourself, comment down in the comment bar, and in our next video, I can hopefully answer those questions. And don't forget to subscribe, like, and hit the notification bell on.
Bye! Your ass? What's wrong with your ass?
My eyes.
This is the great plug.
You have great knowledge for it.
Not that one. The one before.
Blah 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 blah. Blah 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 blah.
And blah.
Blah.